Okay, so with foot drop and the gait pattern that can evolve from that, the steppage gait or the slap foot, some people have more of a, I'll back up so you guys can see. Some people have more of a drastic movement at the hip to compensate. And then some people will like slap, they'll use momentum and they'll kind of like fling their foot forward to like pop it up there. Does that make sense? So that's just when you see that you can know, oh, that person has foot jump. Now I will get into the presentation. So share again. Okay, can everyone see that?
Yeah. Foot drop. Foot
Okay.
drop.
Cool. All right, I'm gonna ask everyone to hold questions till the end, if that's okay. If you have a burning question and you can't focus until you just have to know this, just wave at me or something like that and we'll pause. So foot drop is weakness or paralysis of the tibialis anterior muscle, which lifts the foot up. It attaches to the shin and the foot bones, and the nerves that innervate it are L4 and L5. So it is not a disease, it's a symptom. So this is very similar to dementia. Dementia is not the disease itself, it's a symptom. Pain is a symptom. So it's not, it doesn't tell you the cause of it. It is a symptom of an underlying muscular, neurological, or anatomical disorder. It can be temporary or permanent. Now, did I keep this up? I wanted to show you tibialis anterior. Just because I'm a visual person, so I imagine somebody here is. It runs along the front, oops, the front of your shin, like that, and it goes towards the inside of your foot. If you remember, when we contract, muscle fibers run this way. So here, these muscle fibers are going to all run vertically. When you stretch a muscle, the fibers elongate and kind of separate. You can think of it like that. And then when it contracts, they get shorter. So if one end of the muscle is, for lack of a better, it's glued to your tibia and one end is glued to your foot, and that muscle contracts is going to pick your foot up. Everyone see that? So that's the muscle. It's also kind of cool. This will be a good image, is to look at the innervation. So this is a good one. So this is looking at the back of the leg. And so it comes out, there's a big sacral plexus, which is where all of the nerves come out. Lumbosacral plexus, you might hear it called. The lumbar and sacral nerve roots all come out of the spinal cord and join into like a cord, like a bundle. And then that goes down and branches off and branches off and branches off all the way to your toes. So keep this image in mind when we're talking about nerve injury. Your nerve injury could be happening in your spinal column. It could be happening at the sacral plexus, the sciatic nerve. It could be happening behind the knee. It could be happening on the side of your shin. It could be happening, that's pretty much it, because it's the peroneal nerve. So that kind of ends there. That's, I guess I could do peroneal nerve anatomy. So you can see this is the top of where it innervates the muscle. So anything pressing on the lateral side of your shin like that. But again, you can see it comes down from the spinal cord. So just want you guys to have that visual in your brain. So causes can be nerve injury, brain and spinal cord disorders, systemic causes, congenital muscle disorders, tibialis anterior tendon rupture, which is very rare. We're not going to really talk about that one, but that would be where the attachment at your foot for some trauma or injury is torn off of the foot. And then idiopathic, I hear, so if you guys have heard this word, it basically just means that the cause is unknown. So a lot of things will get deemed idiopathic. There are certain diagnoses that don't always have like a direct cause per se. But it could be, you know, either unknown or that person's health team just can't find a clear diagnosis, because some of them are very clear and some of them are kind of diagnosis of exclusion, where it's like, okay, it's not that, it's not that, it's not that, it's not that, it must be this. So those take a lot longer to diagnose. So the most common nerve injury is damage to the peroneal nerve, which would be up at your shin, just on the side of your shin. The second most common is at the L4-5 level of your spine, if the L4 or L5 nerve root are getting compressed, for example, by a disc herniation, or your facet joint is deteriorating, or there's stenosis of some sort. Stenosis means narrowing. So if there's any bony overgrowths that are pressing on a nerve like that, it can also happen at the level of the sciatic nerve, the lumbosacral plexus. So things that cause nerve injury, again, think of that entire nerve path. So from your low back to the top of your shin, that's a long way. A lot of stuff could happen along there. So depending on which site it is, like if you're crossing your legs for a long time, I'm motivated to stop crossing my legs so much after putting this together, because I do that. And so this one's more sneaky. This one, kneeling for a prolonged period of time. If you have a job that requires either of these, like or long distance traveling, a lot of people that drive thousands of miles, if your leg is resting against the door and then there's that vibration, or if you're always sitting in funny periods, certain one of them said lotus pose in yoga, just depending on prolonged squatting. So it could be positional. And that would be more like chronic compression to the nerve. Trauma to the knee, hip, or pelvis. So this could be fracture, dislocation. This could be, you know, sports injuries, car accident. And then there's surgeries. You know, if you sign up for a surgery, you're signing your life away. And I do have a family member that they didn't get foot drop. They got the opposite of foot drop. So they can pick their foot up, but they can't raise on that toe. And that was from a low back surgery. So that could happen. Low back injuries like a disc herniation or facet dysfunction, degeneration, pinching on a nerve, a leg cast, childbirth. That could, if your feet are up in stirrups for a long time, it can affect the lumbosacral plexus if the baby's head is pushing on that as it passes through for too long. What other one was I going to say? Oh yeah, toilet seat with insufficient padding. This is like for someone who has a very low percentage of fat, like they're very emaciated and there's no fat pads. Our body is covered with fat pads over certain bony prominences to prevent the bone from tearing through the skin and muscle. So it, you know, if you lose a lot of weight from cancer or from some other reason, people that are, you know, if you're sitting on hard surfaces or just things like that, that could be more susceptible to a nerve injury. So this is probably, this is one of the most common. The second would be from something like a stroke. So that's when I've seen it most. So any brain and spinal cord disorder could cause it. Injury directly to the brain or spinal cord, whereas the nerve injury, we're talking about the peripheral nerve, which is once it exits the spinal canal. So stroke, multiple sclerosis, ALS, cerebral palsy. It could be from systemic causes like diabetes, inflammatory conditions, autoimmune things, ischemia, which is a lack of blood supply. And then muscle disorders would be muscular dystrophy, Charcot-Marie-Tooth, polio. Don't have to worry about that one too much. Tend to happen bilaterally. So the imaging will get done if the cause is unknown, if you're having a slow recovery, or it continues to get worse despite treatment like physical therapy and stuff like that. One of the things that I can't forget if I can't remember if I put it on the slide, but the earlier you act, the better. So somebody like you, Aunt Law, this would be perfect to when you go to PT for prehab, just talk about this on day one. Say, I'm really here for 2 reasons. The way that physical therapy works is it depends on how each physical therapist might operate differently. Like I might do a knee evaluation and then I might do a separate foot drop evaluation. So they might do it like that, or they might combine it in one. But you can say, hey, this is really concerning. I want to do all the tests. So typically they might do an MRI to look at the nerve path. And typically you'll end up doing an EMG test, which is to test the muscle activity, and nerve conduction studies test the nerves. So you could even get that going through your PCP before you start PT. So going on to treatment, PT or OT to strengthen the foot, ankle, and leg. So you want to maximize what you have and maintain it as long as possible. So there's kind of 2 different goals here. So the first goal would be recovery of that action. I want to be able to lift my foot. Right now I can only lift my foot 80%. I want to lift it 100% again. And your muscles and nerves are all able to do that. And wow, look at that, you completely recover. That could be like in the case of an injury, you might have more of a chance for complete recovery versus compensation or adaptation would be like someone in the early stages after a stroke. After a stroke, we are going for as much recovery as we possibly can. And we push and push and push as close to the date of injury for recovery. And it takes time. After neurological injuries, people can recover for 3 years, 5 years. They can just always still be making these little improvements. But at some point, then we come in with compensatory strategies like a brace. So a brace is saying, I'm not going to recover the muscle function, so I want to walk safely. Let's do this. Does that all make sense? Yeah. Okay. So in the goal of recovery, we could use neuromuscular electrical stimulation. Can be done while sitting or while, laying. This is to help recover the muscle function and reconnect that nerve muscle connection. Sometimes that nerve communication just isn't getting all the way through. So NMES kind of helps facilitate that communication happening faster. So that would be with the goal of recovery. FES, functional electrical stimulation, would be, for example, somebody that has a stroke. The injury happened in the brain. So the path of the nerve is actually intact. The nerve is fine. So the functional electrical stimulation goes right below your knee.
Mm.
And it's gotten so advanced that while you're walking, it knows the gait cycle. So it knows when you're going to lift up your foot, and it turns that electrical stimulation on at the moment you lift your foot. So this is something that it will have to be worn for. If you want your foot to lift up, you have to be wearing this. Like you have permanent damage. You can't lift your foot. It's permanent foot drop, but the nerve is still intact and can communicate. So it's able to, it's responsive to this treatment. So this would be a compensation. Braces, you might have heard it called an AFO, an ankle foot orthosis. This can go internally into inside your shoe or outside your shoe. So there's a couple, there's AFO. So this is like the classic nowadays. This is like, it's fine. It's good. It's just that this is like one of the first models, probably the first model that ever existed. It's thick, it's heavy, it's, now they have some that are a little more low profile, where it's not as thick, it's made of different material that's lighter weight, and it's not quite so obvious, or it's just not as big. There's some like this that aren't as big, and they can be more comfortable. And then the external ones you could wear around your ankle like a little ankle cuff, and they attach to your shoe, and they're kind of spring loaded. So that can help with a little bit of a lift too. And all of these, depending on the severity of the foot drop, yeah, that gives a good idea. Depending on the severity, you might not need something super robust, and you could get away with a little ankle cuff. A lot of people will have embarrassment or just resistance to wearing it because they just don't want to either deal with the hassle, or it's a pride issue and they don't want to be seen, literally don't want to be seen with anything adaptive. Like they don't want to be seen with a walker. They don't want to be seen with an AFO, nothing like that.
Cane.
A cane, yes. And then lastly, depending on the cause, you could be a good candidate for surgery. If it's at the level of the spine and there's something that they can do to either repair the disc or shave it away, or shave away the bone that's pinching on the nerve, they could do that. If there is obvious like muscle or tendon damage from a trauma or something that's causing it, they can repair the muscle or the tendon. There are nerve repairs and grafting. I haven't heard of this very commonly. And then for cases that are long-term, you could do a tendon transfer. I have never seen one of these in real life, but apparently they're successful, and I don't know why they're not done more often. So putting this together makes me want to investigate about that. But another kind of drastic intervention would be a fusion of the ankle and foot bones to improve your gait, but then at least you're not having to put on a brace every time. So yes, what to do, address it as soon as possible with your primary care and your PT. As soon as you suspect that you might have it, and then you might be referred to a neurologist, you might be referred to an orthopedic or a neurosurgeon if there's any suspicion that it could be spine related. And then these doctors will tend to, if you have a chronic case of it, it's just not getting better, they'll tend to repeat these studies every year to kind of just monitor, either assess recovery or monitor like the decline. Especially as new functional things come up. Like if you start falling more, they'll probably be like, what is going on? So any questions on that? No?
So potentially every time I've had a orthopedic surgery, I could be damaging a nerve that could eventually lead to either the slap foot or the foot drop.
Potentially, yes. There's always potential for that. It sometimes happens from the stretching, the retractors or whatever they're called, where they prop the skin open to access the joint, or whatever area they need to access. And then, I mean, it could be cut. There is human error in a surgery. So there's potential, but I would say like the functional difference that you would get, or the functional deficits that you would get from, like, in your case, because I know your case, if your knee is bothering you and you just decide, I don't want to get foot drop from a surgery, I'm gonna not get a knee replacement. Like, I think the knee pain would be cause more dysfunction than getting foot drop from having replaced the knee. So in my opinion, the benefits of getting the surgeries usually outweighs the potential complications.
That makes sense.
Yeah. Okay. I was gonna have you guys run down your book, but I think I will just make this like shout it out. So starting at page 21.
Downstairs.
If you do want to follow, if it's not, we're going to do this mostly verbally. I just want to check in briefly on where you guys are mentally, like confidence-wise / fear-wise with your balance, and where you are physically. So, like, questions that I have for you are, does anyone feel, and the answer might not be yes, we've had hurricanes and a million things, so you might not notice a difference, but I would love to hear if anyone has noticed a difference in, sometimes I feel unsteady when I'm walking. Has anyone they feel a little bit steadier now than they did 8 weeks ago when they're walking?
I feel that I'm paying more attention.
Okay.
When I'm walking, I'm more aware. Unfortunately, at this stage, I think I'm still kind of picking out my shortcomings rather than realizing it's getting better. But at least I'm perceptive enough to go, oh, I'm wobbling, or sometimes if I'm walking down a hall, I feel like I'm, my gait is off or something. So I'm thinking about it a lot more. That's for sure. I feel more confident because I am aware of it.
Cool. And I want to acknowledge how big of a win and how much progress that actually is, because awareness really is the first step. I think that's like a age-old thing with anything, but I cannot tell you how many of my patients have very little, if not no body awareness, just because they weren't in the health field or they didn't do a lot of exercise or I'll say like I'll ask someone, does it hurt? And I'll try to get them to explain something in a different way. And they can only say one word. It's very kind of disconnected from the body. So most humans, especially in the US these days, we live a lot of our time in our brains and we're thinking and thinking. So I would say most Americans are disconnected from some level from their body anyway. So awareness is really huge because if you're not aware, you'll just wake up one day and you'll have super severe foot drop, for example. Like this is a perfect example. So somebody who has more body awareness will catch it sooner. So I think it's awesome that you're more aware. Does that mean you're less worried about falling also?
I've been less worried about falling since we've been practicing falling. It started for me when I fell in the grass that day. I wasn't afraid. I was embarrassed a little bit, but even that wasn't such a big deal. So I feel more confident.
That's awesome. Anybody else want to chime in?
I feel more awareness and I do feel more confident. I still try to stay close to the grass when I'm walking on the sidewalk. But I think about the falling. Okay, I don't want to fall on my hand, I want to fall on my side. So yeah, I picked up a lot of good stuff.
Okay, what about I need to push with my hands to stand up from a chair.
Mm.
Any improvement in that?
Well,
Maybe push.
yeah,
Yeah.
yeah. I think about it more. I can do it without pushing up, but sometimes you just push up because you're not thinking about it. But when I think about it, I try to do it the right way.
Cool. Even using your hands a little less is still a win. Yeah, if you guys want, you can take a peek at page 23 and 24 later and just see if any of these have changed. You could even retake the whole assessment. These are just the questionnaires of are you concerned about falling when you're cleaning the house, when you're getting dressed, preparing simple meals, taking a shower? So if you want, you can kind of go down and do that as a reassessment. Does anyone notice a change in their hesitation or willingness to talk about falls, whether with friends, family, doctors, healthcare providers?
Well, even this morning, I was talking to a lady in my Tai Chi class about falling, and it's more aware of it, and people our age are more aware of the fact that they could fall. So I've had several conversations with people about it.
I've told, everybody that I am close to knows I've been taking this class. I haven't taken it to the next step, which was one of my goals initially, is, to share with them how I prefer to be helped if I do fall, and I will do that. But with friends, I'm constantly talking about it. Some of the tricks and some of the things you told me, like that big one for me was that one of the last things we lose, I don't know if I'm going to say it correctly, is the ability to pull, but pushing is harder. So to push up rather than pull yourself. And I've been really working on that.
Cool.
Did I say that right? Isn't that what you?
Yes.
Okay.
It is. In my clinical experience, I found that a lot of weak people can still pull decently well, but have like no
Okay.
push. Yep. Um, cool. So as long as you have some safe circle of friends, something exercise based, or if you live, in a community where it's frequently talked about, that's great. Um, with families and healthcare providers, you can't control other people, but you can control, like, if you ever have a healthcare provider that you're just not gelling with, you could get a different one. If you don't like the way they talk to you, or if they have kind of negative, um, you know, anything that you're not happy with, you can't change if they have kind of shaming language around falling and, oh, well, you better do this, or they're trying to take away things from you too early or dismiss you. But you can definitely change which providers you see. Okay. I think for old time's sake, let's do another 30-second sit to stand test. So I'm going to run my timer for 30 seconds. And everyone stand up and sit down as fast as you can.
I want to go to a different chair. The chair I'm in is
Okay,
conducive, so I'm gonna move.
Well, I'm sitting on the side of the bed.
that's great. If you can do it without hands, go for it. If you need hands, go for it. Okay, if you happen to have your book and you wrote this down at the beginning, then you can compare what you do today.
I think this was one of the sessions I missed.
Oh, is it? Okay.
That's okay. It's good.
All right, on your marks, get set, go. Doing it with hands is perfectly great. And stop.
Okay.
If you're in the middle of one, technically you're not supposed to count that one.
Okay.
Did anyone record it the first time and notice an improvement?
I did, but it's in my book downstairs. I think I did 10 or 12 or something.
Okay. I cannot stress enough. If this is absolutely a miserable exercise for you, please use your hands. I have a new patient and his wife, and I gave them this one exercise for homework. I said every day, just 10 times, stand up and sit down, and they misunderstood and thought that it had to be without hands. So when I came back, they were like, well, we didn't do it because we can't stand up without hands. And I was like, no, use your hands. And first of all, building muscle strength is a progressive thing. So you'd be surprised how fast you can build muscle strength if you're just a little bit consistent, not even a ton, like twice a week. And then secondly is more concerning to me is what I've said so many times, which is whatever plan you choose, it must be sustainable. So if you if you're miserable doing this exercise, you're not going to like it. You're not going to do it. So don't make it so hard that it's like, oh my gosh, I never want to do this. Okay, we'll just quickly try these foot positions. So if you want to go ahead and stand up, if you want to watch, that's totally fine too. So first we'll try with feet together for 10 seconds. Good. For those of you that this is super easy, you can start wandering your eyes around the room. You can start turning your head more. Look up.
Ooh, that got a little wobbly.
Yep. And again, if you just practice this once a week, twice a week, you'd be surprised how much better you'll feel. Okay, second position is gonna be take your feet and slide one of them forward so that your big toe is in the arch of your foot. So we're approaching the tightrope position, but not quite. One position that's not on here, but I'm gonna have you guys do is just keep sliding that foot all the way forward till your heel is at your toe. But don't cross it over and stand on a tightrope. So there's still, it's like peg your feet together and then just slide one foot all the way forward.
Which one?
Either foot.
Ooh.
People tend to have a natural.
Yeah, I get, that's real balance, challenging.
No, I can't move. I can't move one or the other.
And you can hold on to something to get into position and then let go. So this could be a good countertop activity. If you're feeling good, you can go ahead and now stand like you are standing on a tightrope or you're doing the drunk driving test. Heel to toe.
Okay. Uh,
I don't feel real, I feel a little shaky doing it.
Me
I
too.
can't stand with my feet a couple inches apart if I want to be steady, you know?
Yes.
Yeah, I need to work on all three, all of these.
Yeah.
Okay, last one, everyone's favorite, standing on one leg.
No, get it. Not unless I hold on to something.
Yeah, I can do it if I have one finger on something.
Yeah.
That's on the good leg. Let me try the bad leg. Ugh.
Yeah, it could very well be different side to side.
I can do it, actually, the bad leg is almost better, weird. But I've got one finger on the table.
Cool.
Ah,
I have to hang on too. I can't do that one without
Yeah.
hanging.
me too. I
Good.
gotta hang on. I gotta hang on to it.
It's, for me, it's the finger works because it's a balance. It's a balance. It's not like I don't have the strength.
Yeah.
I just feel like I'm wavering and I'm gonna keel over if I don't have a little grip on something. That's just me.
Well, that's a great place to start. And like you said, like a lot of people don't even have the strength to hold those positions. So just keeping a finger and holding that position, it helps you actually just build strength
Okay, good.
to even achieve that position. If you want to take it up a level, you can try any of these foot positions while closing your eyes.
Woo.
I forget that.
Wow.
So that will really make,
Fun for me.
what's that?
I'll have to
Yeah,
double my
no.
balance medicine.
911 for me.
All
I
right.
think I
let me
want
do
one
that.
of those, if I'm gonna do it, I want one of those big long poles that the tightrope walkers use. So help me balance.
Yes, exactly. And
I already take balance medicine 4 times a day.
oh wow. Well, holding your arms out to the side.
Yes.
I just want to remind you guys, it is totally normal for you to be like Bonnie, you said you feel a little shaky doing that. So that's totally normal. We're doing harder and harder positions. So if you're doing a crazy balance exercise, I would expect your feet to be wobbling, your ankles to be working really hard. You might be, teeter-tottering. When I used to fight really hard to do balance work, I was training back up my left ankle from an injury. And I would sometimes I would be standing on one leg and I would be fighting so hard. I'm like tipping over or leaning really far forward, but I was like, no, I don't want to touch down. So if your body is going all over the place, like that's okay. Unless you're at risk of falling, then you probably don't want to push it too far. But again, benefits of working with somebody that can guard you. You can get crazier and do higher level things with a partner, like i.e. a PT or a personal trainer type. Okay, before we just get into the final thing, I do have my air mattress ready. We're kind of closing in here, so we probably only have a couple minutes. So I'll ask you if you have any questions about the how to fall, principles of landing when you fall, exercises to do. I would ask you to go back and watch those replays because we went through it thoroughly there, and I would pause anytime you get to one that you want to practice. But does anyone have one that they really want to see again real quick? Then I can go do that before we have our final announcements.
At the very, very beginning, you did that great, you became jello and slid off your couch.
Okay.
For me, that was something that it was early on, and I can go back and look on the class, but
I'd be happy to demonstrate that again. Does anyone else have one that comes to mind? And we also did, if you look at the recording from last week, which would be, I think that would be the 14th, if I'm doing my math correctly. Last Thursday, at the end, we did about 10 or 15 minutes of going through that again, of how to
That's right.
fall and using the air mattress.
that's right.
So
I've been practicing falling on my bed.
have you really?
Yes, and I actually I haven't stood up on the bed. That would be too extreme, but like definitely kneeling on the bed and just trying to do that. I love that you just became so fluid when you do it. And just like that gentleman that kept doing it over and over and over, there's something where they're just releasing everything in your body. And I want to get that. I want to be like that. So you said early on, like if somebody was in a car accident or something and they weren't aware it was coming, how they less likely to get hurt because they kind of go with the flow.
Yes.
That's how I want to be.
That is such a big win that you've been practicing. That's awesome. And our body adapts to the forces that are placed on it. So with practicing falling, it might be uncomfortable. You might, be like, ooh, I got a little too excited and the next day I was a little sore. But if you keep doing it, your ligaments, your muscles, your bones are going to adapt. Same with weightlifting. So muscle soreness, while it can be annoying, it actually will go away in most cases. That's so cool. I'm glad you've been practicing. Did you practice in the pool?
It's, we just got cold again, but I did do a little bit. It was almost too easy. I've got to come up with something different. Because you just drop backwards. I'm so comfortable in the water my whole life that this is not challenging. The challenge would be doing it from standing on the side of the pool. That would be
Oh,
that would be a challenge, standing and going, poof.
well, maybe that's your next.
I may have to work up to that.
Yeah. Okay, let me show you the loosey-goosey slide.
Yes, the loosey-goosey slide. I like that.
I love this one. This one is the simplest one and it blew my mind. Okay. Okay. So I'm just gonna do it on this portion.
Yes.
Most people don't have the sectionals, so you really just, I put my hands here and then you just kind of lean back and then slowly slide.
Yeah.
If you have any shoulder pain, just be cautious of that.
Okay.
So that's it. It's so easy.
I know it looks so easy, but when I tried it, it was not that easy.
Was it? What do you remember what wasn't easy?
I just, I don't, I think I probably need to do it without my shoes because I felt like my shoes were holding me. I was too stiff.
Okay. Okay. Now to go back up,
Yeah.
well, I'm gonna pretend like, okay, I laid down. Okay, I sat back up. Scoot your butt as close as you possibly can. You might have to manually bring your feet back. To get back up on the couch, you'll have an easier time wearing shoes because the
Right.
couch will hold your feet there. I've had a guy, his shoes had zero traction and he was sitting there trying to get up and his feet kept sliding out from under him. So with this, you're just gonna, if you can get your elbows up, you can do that, but it's not necessary. I'm thinking of throwing my head backwards and lifting my butt. So
Right.
just like 1, 2, 3, and you're up, and then you're just trying to,
It's a bridge.
yep, it's just a bridge,
It's a bridge. I just got it. Okay.
and then you're just wiggling. And the sooner you can kind of turn sideways and get your butt on there, you can kind of, I'm just laying down right now.
Right.
So I'm not working hard. My butt's on the couch. Now I can rest and catch my breath, and then you can push up from there.
Thank you.
You're welcome.
I just got it. The going back up part, it's the bridge. I got to remember that piece.
Yep. Yep. Some people will try to, if you have really good shoulder mobility, you can kind of crawl
Yeah.
back and do it in a couple segments. So you can do that. The other coolest thing ever that I saw, I don't have the materials to do it, but you guys can probably picture it. An occupational therapist made this video. She had a bunch of books and she would stick one book under this butt cheek and then rock over and put a book under this butt cheek. And she rocked back and forth until her butt was like at this level, and then she was able to get up from there.
Brilliant.
So that was a really cool idea if you ever fall near a bookcase. Gotta get creative. Use the things you have
And
around.
you got to use hardbacks, right?
Yeah, yeah. Okay. We'll do announcements and then y'all can ask any last questions. But I just want to say thank you guys so much for spending the last 8 weeks with me and being so engaged. It really has made this so easy and fun. And that's always my preference, is like lots of questions, lots of conversation, because I want to serve the three of you. I don't care what questions anyone else has. You guys are the ones showing up every time. So really appreciate just all the engagement and consistency and just your commitment to 8 weeks. I know that is a big commitment, and twice a week. So I just really want to say thank you so much. I've wanted to see what this would be like to run it online, and I really liked it. I have to say, I think I liked it better than teaching it in person, for a number of reasons, but yeah, I had so much fun. So just thank you guys for showing up every week and making this really fun. So
Thank you. You're an excellent teacher. And you came up with, like I said last week, you taught from a different perspective than just do this exercise and repeat it 3 times and do the next exercise and repeat it 3 times. And I'm so sick of that for all my, but I'm just sick of it.
I think
Thank you.
the Zoom thing is really good because I enjoyed the feedback from Carol and Law, because they would come up with things I hadn't thought about, and you could explain all that. So I've enjoyed it very much, a lot, and I've met 2 more nice people.
Aw,
Thank you.
thank you. I've
Which-
really enjoyed it. And Amber, you're very welcome. I am really surprised because procrastination is one of my biggest challenges, and I don't always show up. So I'm going to give you a lot of credit because you made it interesting. And like what Bonnie was just saying, I've enjoyed the company of Bonnie and Carol both, and listening to things they've gone through has helped me as well. But I just want to acknowledge the fact that not once in this whole 8 weeks have I felt that you were talking down to me. And I really appreciate
Oh,
that.
I
I think you respect me as an elder, and talk to me with respect, and as in a teaching role. I think that's so important. Thank you.
Oh, you're welcome.
Yeah.
Thank you guys for all the kind words. We all love each other. It's so
If
great.
we were there, we could do a group hug right now.
Yeah, group hug,
Oh.
air hug.
Oh, great.
Hearts.
Yes, there you go.
Have you guys seen this one? If you have the react button, if you're on actually, I think it works on your phone too. If you press the react button, there's something that says send with effect. You can do hearts,
Mhm.
Aw.
or you can do like celebration. So you can do that. Yay! Speaking of, appreciating each other, if you guys want to exchange phone numbers, email addresses, a way to stay in contact, you guys can do that. You can do it from the chat. If you want to throw your number, email in the chat, you can go ahead and do that. So you guys can stay in touch. If you ever have any questions about, at least you know that it sounds like you guys already have people to talk to about falling and fall questions, but we know that the 4 of us are safe people to bring these questions to. So if you ever have any questions, feel free to reach out to each other and stay in touch. I am going to be emailing you guys some little honorary certificates.
Oh.
Look like this. So first up, we have
Da-da-da-da.
Carolyn Wolf, also known as Law.
Yay.
Everyone clap. So
Yay!
this is just kind of funny. Just
And the second ever.
appreciation. Thank you. Appreciation for participating in the second ever and first ever virtual version of the 8-week bird balance and fall prevention class.
Oh,
And next we have Bonnie.
Bonnie.
Yay. And we have Carol. Good job,
Yay.
everybody.
Thank you.
I'll be emailing those to you guys. I will also be emailing you some kind of feedback form with different things on. I kind of just got it from you now. But there will be some things on teaching style. There will be some things on like content specific questions. There will be some stuff on the format, like accessing Zoom, accessing school. Was that user friendly, or would you rather just get an email with a link? instead of having to do a whole login thing. I initially I was gonna go with school, and then one of my friends has run a group through Facebook. So I tried to figure that out, and then it was brought to my attention, like, not everyone is on Facebook, and, I was having a hard time figuring it out on my end. It wasn't as user-friendly, but there'll be some questions on that, just like format of the class. So just be looking for that in your emails. There's not a huge rush, but if you could fill that out, it would mean a lot to me. And reminder that I will be doing away with school soonish. I can't remember exactly what date. I might leave it up for another month. I haven't decided. Really, it doesn't affect you guys at all. You will just access the videos differently. So you will have lifetime access to the videos through YouTube, and you can just save that email somewhere that you remember where it's stored, and so you can always access those. And then lastly, just another reminder, I'm leaving the ball in your court to schedule a one-on-one phone call with me. So you can schedule those anytime. I do ask that you try to use it, like, I don't know, in the next 6 months or year. But there's really no rush.
Wouldn't remember it that long.
Yeah.
I'll use it because I've got surgery coming up, so I'll definitely use that hour.
Yeah, cool. So, is there any last questions or final remarks?
I do like accessing through your email to the Zoom meeting. And one personal note, you have got the prettiest teeth of anybody.
Oh, thank you. Thanks. I'm glad.
You-
Yeah, I think
Christmas tree up early.
what's that?
You've got your Christmas tree up early.
I do. This is a thing I just started last year. I used to be a real stickler about you must celebrate the holidays in order. This is ridiculous. We have to celebrate Thanksgiving before we can think about Christmas. And last year,
Mhm.
for whatever reason, like one of my roommates wanted to put it up early. I loved it. It was like just adds a little bit of festive. The built-in lights just have the perfect, I don't know, it's just nice.
Look pretty.
Anybody else have theirs up?
I'm going to, this week, my friend's coming for a week and she doesn't know it yet, but she's gonna help me put Christmas up Monday.
Nice.
Good for you.
We don't have any ornaments on it yet. We're hopefully doing that tonight, but it already looks brighter. Is there something else? Anybody else have any last words?
I just hope everybody has a wonderful Thanksgiving and a holiday, and I've enjoyed being with all of you. It's been fun.
It's been a lot of fun and I've learned a lot.
Yep.
And I'm sorry I had 3 injuries during this this time. And had it not been for that, I would have really made a lot of progress with what I've learned.
Well, I'm sorry that you had to go through that, but the content is always there. We're always there. We're not going anywhere. So if you want to keep in touch,
Mhm.
yep. Carol put her email in the chat for anybody. And then if you forget, and just email me if you want to get in touch with somebody.
Okay, I don't know how to get to that because I'm on my phone, so.
Okay.
Just hit the little chat thing. I'm on my phone
I
too.
will, is everyone okay with me sharing their emails?
That would be fine by me.
Yeah, that would be easier for me. I'm
Thank you.
good on that.
Okay, I will send out the emails, and then if you guys want to exchange phone numbers there, you can privately email each other.
Right.
Sound
Good.
good?
Sounds good.
All right, thank you guys so
Okay,
much.
thank you for taking some of the fear out of the fear of falling.
That
Amen.
was the goal.
All right.
Bye.
Bye. Happy
Okay.
Thanksgiving.
Happy Thanksgiving.
Yes, happy Thanksgiving.